In a country so packed, 164 million people crammed into an area the size of Wisconsin, and so poor, about half the people here make less than $1.25 a day. Just staying alive in Bangladesh can be a challenge. To help, dozens of NGOs or non-governmental organizations have operated hundreds of health clinics across the country. But after several decades, there were noticeable problems. Clinics coated with mold or crumbling. Some still lacked running water. Others offered little more than family planning services. You could find medical waste thrown out a back window or dumped by the front door. Some were missing out on a precious opportunity. Too many people were dying from medical problems the clinics could have been treating, even preventing.
Many children died of infections that could have been easily treated. Many newborn babies died because there was no postnatal care. Many women died while giving birth because there were no doctors available.
Something had to change. In 2007, USAID, the U.S. Agency for International Development, devised an innovative solution, creating a franchise of clinics that could actually become self-sustaining.
We're looking to do this very differently. We've got to change a lot of people's thought processes, change their attitudes.
It all began by changing appearances. Every one of the 323 clinics is given the exact same look, the same feel, from the Smiling Sun logo to the color of the furniture to the crisp new uniforms. New standards for all to see.
We want to establish the brand value or the brand image. We want to impress upon people that every clinic that they go into will have the same quality look, same quality service and products.
To improve quality, employees receive months of new training, and Smiling Sun clinics get up-to-date medical equipment. Services are expanded. Many now offer everything from elaborate blood tests to maternity services. Suman was born here just 5 hours ago. The Hawk family comes to this clinic for flu shots. Mrs. Hawk gets an injectable contraceptive, and their 5-year-old is treated for typhoid.
There are more facilities here. It's easy to get to. The medical service is good, the doctors are better, and people in our neighborhood say it's a good clinic.
The people get better services from these clinics. Government is very much satisfied on this Smiling Sun project. They're doing well, really.
If Bangladeshis can't get to the clinics, Smiling Sun clinic workers get to them. More than 1,000 are dispatched into the countryside every day. At this tiny schoolhouse, they're providing prenatal counseling and physical checkups.
We get all sorts of support here. That's why we come here each month, to discuss whatever problems we have, and they give us the solutions.
But what's most remarkable about this whole transformation is how these clinics are starting to pay for themselves. There are now fees posted right there on the walls. A month's worth of contraceptive pills sells for the U.S. equivalent of 7 cents, antibiotics 29 cents, doctor consultations 71 cents. This project is shown on an unprecedented scale that give people here affordable quality health care, and those who can pay will pay, and enough to help cover the costs of those who cannot.
People said it couldn't be done. People said that people were not willing to pay for health services, that you would not be able to recover your costs, and that the quality was as good as it could be, and we've proved them wrong.
Bangladeshis are now subsidizing the care of the poorest of the poor and relying on Americans less and less. Since this program began, the clinics are attracting 20% more patients, a total of 12 million a year. And what's most important, they're saving more lives. At least 1,000 more so far in maternity cases alone.
This is working, and working well. This is not fancy medicine, it's essential medicine that we can count on. This Smiling Sun project is providing a brighter future for so many people. This is something we can all be proud of.